Chaiyaphum municipality have responsibilities for proving public services for the happiness of people in locality. Healthcare Service Center of Chaiyaphum municipality have learned about the disease from our patients and acknowledged the problems in the social perspective from our community networks. Database of Health Data Center show new patients diagnosed with chronic kidney disease caused by diabetes and high blood pressure tend to increase for the last 5 years. This finding has triggered us to get ready for the worst, even though we still hope for the best that no one has ever needed the hemodialysis. The center is established as the most appropriate and possible choice which most patients could afford. The division has to sign the memorandum agreement in order to arrange for dialysis machine installing at the centers. In addition, we also work with community networks in order to maintain both before and after service. Village health volunteers are assigned and trained in order to monitor and evaluate patients who live in their community with our family care team. The center has to sign the memorandum agreement in order to receive 1,500 baht from National Health Security Office for support medical fee. 142 local government organizations have signed the memorandum agreement with Chaiyaphum municipality to provide inclusive sustained monitoring and transporting patients from home or the bus station to the center. Reduce the traveling expense of patients 1,200 baht per month. Increase the patient's family income 200 to 300 baht per day. From the memorandum which the center has signed with Konkan University, they can use the application called CKD Rakdai for monitoring patients and appointment online. Poor lifestyle choices such as smoking, overuse of alcohol, poor diet, lack of physical activity are key contributors in the development and progression of preventable chronic diseases. The initiative is intended to provide prevention treatment and promote mental health and well-being to all members in Chaiyaphum communities through village health volunteers. The center has target on people at risk of having diabetic and high blood pressure, the two main causes of the chronic kidney disease, who are 35 years or older. Then, after trained by physicians from the center, the village health volunteers are provided with the target names as well as their address and asked to measure their blood pressure, weight, height and fasting blood sugar. Next, the physicians can analyze data and categorize the targets into groups: normal, at risk and NCD group. Finally, the treatment procedure would be appropriately applied to each and everyone in the group. Conclusion: even though all members aren't any patients in need of the hemodialysis, the initiative is quite successful in terms of preventing and building awareness to the communities. Members of communities have learned about the health literacy model in order to promote proper health behaviors which help to decrease the non-communicable diseases, especially high blood pressure and diabetic, which cause the chronic kidney disease. And the initiative has sustainable monitoring and evaluating patients through community networks.